When I see someone come in, a man, I'll just give an example, that's overweight, that feels crappy, and we look at their lab panel, I just like froth at the mouth because I'm like, I know how to fix this. Fix their testosterone, fix their insulin resistance, and it's this beautiful marriage. All of a sudden, life changes, and just they get back to the person they want to be. I'm a prime example. It happened to me.
Welcome to Look Good, Feel Good with Matt and Amy McKinley, the podcast where we bring you expert advice and honest, real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in. Welcome back to Look Good and Feel Good with Matt and Amy. I'm Amy.
Hello, and I'm Matt.
Today we are going beneath the surface to explain how high insulin creates inflammation at the cellular level. It's a story of fat cells. So we're going to be talking about fat today.
We like telling stories.
We're going to be talking about how fat cells, when they get too big, they get too crowded, and eventually they become sick. That's what we call hypertrophic fat cells. And that's, and when we talk about these cells, that's the real root of inflammation. So we're going to be talking about what causes inflammation today.
Yes. Another word for this is insulin resistance. We hear about this a lot. It's kind of a trigger word that you'll see in the media, you'll see it in medical clinics, but insulin resistance is something that I think personally probably 80% of America has because of the way that we've eaten, the way we've been brought up eating processed foods. And a lot of times people blame it on genetics, they blame it on other things, they blame it on poor diet or sleep, but really it's something that happens over time. Doesn't happen quickly, and it probably, is affecting our kids. Well, it is affecting our kids, and it happens at a young age, but as we age, then a lot of people start to feel this chronic fatigue, painful joints, inflammation everywhere, and hormones play a massive role in this. So overinflamed fat tissue, as Amy mentioned, or hyper, which means high insulin.
This is a story of when fat cells go bad. So when we talk about
fat cells go bad, happens at a young age.
Fat cells gone bad.
That's right.
So insulin's job is to store energy. That's what insulin's supposed to do. When your insulin levels stay high way too long, it tells fat cells to keep on growing. And that's what we call hypertrophy fat cells or hypertrophic fat cells. But as they expand, as fat cells grow, they get further and further away from blood supply. The further they get away, they start to kind of suffocate. They don't have as much oxygen or blood supply. And so what they do is they release these inflammatory, what we call, they're like little breadcrumbs, but we call them cytokines, these inflammatory breadcrumb cytokines. And that's that's the body's distress signal. And what happens is little capillaries start to kind of grow towards suffocating part of the fat cells. And anyway, that's what inflammation comes.
Nice.
Anyway.
Nicely done. So think of cytokines like little smoke alarms that are not going off. They continue to be, okay? They're going off consistently, and they start to cause swelling and inflammation. And one of the big things that happens here is triglycerides raise. Triglycerides are basically fat that's carried within our blood, okay? So these fat cells in our blood, and it's interesting, when we spin blood, before we send it off to a lab, I can look at a vial of blood, and we do this when we do PRP injections as well, but I can look in a vial of blood before it's sent to the lab, and I can tell you if they have high triglycerides.
Yeah.
Because it looks cloudy. Part of the blood, part of the serum looks cloudy. And it's you can almost look at a person prior to drawing their blood and tell you, they're going to have high triglycerides.
Yeah. Exactly. And that's why triglycerides is one of the strongest signs of insulin resistance. When we see high levels of triglycerides on lab panels, we can definitely say, they've got some insulin resistance going on, and some of their other hormones we'll notice are lacking too. But that's the biggest signal or sign to insulin resistance.
Yeah. So you'll see high triglycerides. You will also see high hemoglobin A1C. Okay. Those two go together. If you don't even need to, you need to test, but if I see those two things on a lab that are high, I can tell you automatically they have insulin resistance. There's no question. It's all hormonal related.
So we talk about the inflammation cascade, and really it's when fat cells start to kind of leak. They leak these fatty acids into the bloodstream, and they combine with these cytokines. We talked about these cytokines that are inflammatory, in nature. And what they do is they form the fatty acids, and the cytokines form something called ceramides. And ceramides are really toxic, that they worsen insulin resistance is what they do. They worsen insulin resistance even further. And that's kind of when we see this domino effect. We see high blood pressure start to come up. We start to see fatty liver.
Yep.
Women that have PCOS, this is kind of what's going on, insulin resistance.
Always. You'll see it always in PCOS. Insulin resistance is the cause.
Yeah, and we'll see it in cognitive decline. We'll see it in, your testosterone levels will go down too almost every time. So that's the things that we start to see.
Yeah, low testosterone symptoms in men correlate almost always with insulin resistance. So it's not just a diet problem, it's a hormonal problem. When men start to see their testosterone levels decrease, they feel inflamed. They also start to get this truncal obesity or fat around the midsection. So I can think of a patient, daily, this happens daily, that will see men, they come in frustrated. They're like, oh man, nothing works for me. I work out hard. I'm trying, I'm eating good, but guess what? No changes. And we do their lab panels and we're going to see insulin resistance, and we're going to almost always see at the same time lower testosterone levels. So it's really about fixing the testosterone that goes hand in hand with fixing the insulin resistance. So I have a good friend in his mid-30s, okay, and super frustrated, used to be a college athlete, comes in and he's like, man, I don't know what's wrong with me. And this guy was a lineman, okay, so he's big. He's 6'7", and quit playing football. He thought he would lose weight pretty quickly, but he didn't. Even eating well, okay, eating well and exercising, he didn't lose weight. We did his lab panel and his testosterone level was under 200, okay, very low. His hemoglobin A1C, which is a measurement for diabetes, was high. Put those two together and that spells insulin resistance. So within 6 months, we fixed his hemoglobin A1C, we fixed his insulin resistance, we fixed his testosterone levels. Guess what? He lost 80 pounds and has a complete new outlook on life. His joints no longer hurt. He's a happy dad. He's a happy husband and just living his best life.
Some people think this, like what Matt was saying, it's not just a diet problem. It's a hormonal communication kind of gone haywire. So when we optimize those signals, like utilizing intermittent fasting, we talk a lot about intermittent fasting. We talk about resistance training a lot with our patients, and we optimize testosterone for both men and women. And, it's one of those things where those sick fat cells start to kind of shrink. They become insulin sensitive again, and inflammation starts to kind of drop, and those people feel like themselves again.
Yeah, I get super excited, and this may sound kind of weird, but
it's kind of nerdy, actually.
This may be nerdy, but it's freaking awesome. When I see someone come in, a man, I'll just give an example, that's overweight, that feels crappy, and we look at their lab panel, I just like froth at the mouth because I'm like, I know how to fix this. Fix their testosterone, fix their insulin resistance, and it's this beautiful marriage. All of a sudden, life changes, and just they get back to the person they want to be. I'm a prime example. It happened to me. I waited way too late. I was 50.
And Matt and I were looking at pictures from us in Hawaii in 2022.
Yeah, it was January of 2022.
And yeah, we were both.
We're
both.
It was bad.
Matt and I both, were overweight, not living our best life, and it's amazing now looking back.
Yeah, 40 pounds.
Recognizing it now, and so 40 pounds for me too. So
yeah,
both of us are insulin resistant, and healing that, I guess.
Yeah. So when we tell you these things, we're not just like saying, "Oh yeah," we've experienced things ourselves, and when you have experience, that's how you can really tell your story to others, so they can live the life they want.
Yeah. So when Matt was talking a little bit about you can see inflammation on the outside. So it's one of those things where you can see it, you can visually see it, and you can also measure it, through lab work, which we do. We talked a little bit about triglycerides, insulin levels, high HbA1c, hormone, low T, low testosterone. You can see it. So it is one of those things where you can diagnose it.
So test, don't guess. Get a test done, and this gives our scientific information that we need. And we've treated hundreds, now over 1,000 patients that fit into these categories. So when you see high triglycerides, high hemoglobin A1C, the inflammation markers are high, we get those reversed within 6 months with hormone optimization. And this is when it's a beautiful story. And for me and Amy both, I know we go home at night talking about, wow, I just saw a patient back that was 6 months out, and listen to these changes. That's what gets us fired up, because it's nothing we're taught in school. It's something you have to figure out. And having the ability to do that now has brought us so much joy to bring happiness into other people's lives.
I think that's been, like I say, the funnest part of our jobs too, is helping to change people's lives. So if you've been fighting fatigue, fatigue, joint pain, weight that doesn't come off, stubborn weight. It's not just willpower, it's inflammation. And that inflammation is usually from high levels of insulin, from insulin resistance. And so come and get your labs checked. This is where optimizing hormones comes into play. And we need to shrink that fire from the inside out is what it is.
Yeah, so you don't have to live in inflammation. When we fix your insulin resistance and fix your hormones, life opens up to a beautiful picture, and they work together. I want to throw in one other thing, and it's sex life.
Sex life? What does that mean?
Improvement in intimacy.
Sexual function or intimacy.
And sexual function,
okay,
yeah.
There we go.
So insulin resistance and low testosterone, you fix that, and guess what? Your intimate life or sex drive, sex life with your significant other, wife, spouse, whatever you want to call it, improves dramatically. And this is one of the things that people tell us, usually at 2 months, but for sure at 6 months and beyond. And that's a big deal in a marriage or a relationship. It's not just about feeling good, it's about performance as well.
When you fix insulin and hormones, everything starts to work again, like Matt was just saying. And that's what we mean when we say look good and feel good. It's, because your hormones and insulin are in sync. Your whole life comes back online. That's the exciting part of our job too.
Yeah, we love this. If you know anyone that we can help, because I know you do, because they're walking around you every single day.
And even yourself, like that.
Yeah, if it's yourself. Our goal is to help as many people as we can live a happy, healthy, abundant life.
Thank you guys, and have a great day and take care.